right. Hello, everyone. Thanks for tuning in today and joining us on our program today. We're coming back. Now what? Return to the in-person workplace. I'm John Hovey from the North Metro SBDC, and I'm delighted to introduce today Courtney Berg. She's one of our business consultants. She's also a Society for Human Resources Management Senior Certified Professional, founder and owner of Courtside Consulting. And you can find all about that at her website, www.courtsidehr.com. If you're not familiar with us, you're just learning about the SBDC, then just a quick word about that. North Metro SBDC, we are housed at Front Range Community College in Westminster, and our mission is to help existing and small businesses to grow and prosper. And we do that with free, confidential, one-on-one business consulting with a whole roster of excellent consultants. And we also provide free and low-cost training programs like this one today. And you can learn more about our mission and what we do at northmetrosbdc.com. So for today's webinar, what we'll do is we have disabled your cameras and muted your microphones for the audience, but if you have any questions at any time, please use the chat feature of the app if you're on a phone or on your go-to control panel on the right side of your screen. If you're using a computer, chat those questions in at any time. And we're happy to be interrupted. We'd love to answer your questions. That's what this is all about. We want to make sure that you get the information that you need. I'll also be recording this, and afterwards, I'll send you a link with the video and some follow-up notes so that we can make sure you get all the material. All right. Well, Courtney, Colorado is getting ready to reopen, as I'm sure our audience is aware. And I put in the description for this a study that I read. Pew Research Center said 70% of employees have been doing remote work for at least part of their work during this pandemic, and it was 20% pre-pandemic. And we got big changes ahead. I'm excited for this presentation because obviously nobody knows the future, but we can at least try to be prepared.
Yeah, absolutely, John. It's been a whirlwind of a ride over the last 12 months for sure, and I think it has changed the way we do work. I think that as we're moving out of everybody's at home and no one's really in the office, and we start to move into that hybrid model, I think we're going to see some changes with the way that the executive suites, that the business owners and the managers look at remote work. And so I think it'll be fun, and we're going to go through some statistics right off the bat to talk about that before we get into everything that we're going to cover today.
Nice.
All right. So I'm going to take it away. Is that all right, John?
Take it away.
All right, perfect. I will do that. I'm excited to be here. Thank you so much to the North Metro SBDC and John, to you for inviting me to come speak today. It's a privilege to be here. I enjoy so much working with the SBDC clients, and certainly enjoy doing these trainings. So as I said, it is a privilege to be here. What are we going to talk today? What are we going to cover? We're going to be talking about how to handle continuing COVID issues, even though we're starting to come back and we're seeing the numbers start to dip lower, and we're seeing some changes in mask requirements and those types of things. As business owners, as managers, you're still going to be required to handle COVID issues. So we're going to talk about that. Specifically, we're going to get into vaccines, and we're going to get into making your office safe. Then we're going to move into resetting expectations with employees. What I'm finding is that as employees are starting to come back to the workplace, or even if they've been back there for a while, there's a transition of coming back from working from home and getting back to work. And I don't just mean that you can't wear pants with drawstrings. I'm talking about different things that are setting expectations with employees, dealing with coming back into a work environment and what that might look like, as well as communication, as well as just reestablishing those expectations of being in the office and doing work. So we'll be talking a little bit about that. And then also the last thing we're gonna end with is supporting employee mental health. we are seeing increased numbers of guns in the workplace. We're seeing increased numbers of workplace violence. We're seeing increased numbers of depression and stress in the workplace. And so I'm going to talk a little bit about that today as well. And so let's get started with a couple of statistics. The question was asked, how successful was work from home? And this was done by Price Waterhouse. They did a US remote work study. And what I thought was interesting here is that in the past, looking at working from home was typically a no. We're not going to do that. We're not going to do remote work. Business owners, managers felt like, people cannot work from home and be successful. And I really think that COVID-19 changed that paradigm. I think what we're looking at with these statistics is you're seeing that employers actually felt working from home was more successful than employees did. There was an interesting point here, however, and that is that 6% of the employers interviewed and 6% of the employees that were interviewed both felt that it was unsuccessful. So about the same amount of participants in the study felt that it was unsuccessful, whereas you're seeing that employers felt it was more successful than employees felt it was. So I found that interesting. When we were looking at the employees and saying, who wants to come back to work, right? We're finding that more employees want a hybrid model. They want to work from home 2 to 3 days a week. There are other employees that say, no, I just want to always work remote, about a quarter of the employees surveyed. And then there are some that say, I just want to work in the office. But what we're seeing basically is that inclusion of working from home, working remotely, as being a higher priority for all employees. Now, of the employees that wanted to come back to work, that's 17%. They want to come back to the office. We found that parents with kids at home want to go back full-time more than those without children. And also married people want to go back full-time more than single people do. It was interesting, though, on the other hand, people from the Northeast are more likely to want to stay remote. So some of the interesting points from the study that Harvard did. So let's talk about getting back to the office. We are seeing more and more businesses returning to work now, especially with all the vaccines that are getting into arms. But many employees are resistant. They're resistant to coming back to work. They're resistant to what that means. They're having some reentry issues and some reentry stress. And when you think about it, they have a lot to consider. So they're going to be thinking about, does the person I'm sitting next to or sitting close to have COVID? Do I have COVID? And am I going to infect the office? If there's someone in their household that is at an increased risk of severe illness or someone who's immunocompromised, they may feel that going back to the office is actually just a bigger risk than they're willing to take. Maybe they're a primary caregiver for someone who, again, is maybe elderly, over 65, or maybe immunosuppressed, or someone that could get the disease and get more severe infection than others. And so they're concerned about going back to work because they might infect that person. So some of the questions they're looking at are, how can I minimize the number of people that I'm going to interact with? Well, I could stay at home. Is that an option? How do I work with my employer on that? And how long, if I'm going to interact with people at work, am I going to have to interact with them in a close proximity for longer than 15 minutes, which isn't recommended? I don't know what this looks like. So a lot of considerations employees are asking or making as they move through this re-entry process and coming back to work. And as employers, we need to be thinking about those employee considerations. We need to be looking at that and saying, hey, we realize this is stressful. And so we want to answer as many of those questions as we can. And when you're thinking about answering those questions, really start looking at the safety of the employees at work. So safety is your responsibility as employers. You need to make sure that employees have a safe work environment. So you need to be thinking about what kind of screening you want to do as the employees enter the building. Also as the customers enter the building, right? Do you want to be taking temperatures? Do you want to be asking them about COVID symptoms? What exactly do you want to be doing? Do you want them to maybe do something at home? And so maybe there's some apps out there that people are using that has a daily check of symptoms before they come back to the office, right? What kind of screening processes do you want that employee to go through? And then what kind of equipment do you want to provide them at work? So do you want to give them masks? Do you want to give them gloves? Do you want to give them sanitizer? Do you want to give them all of those things? What do you want to provide? And once you provide that, when and how are you going to provide replacements? So how often do they get masks? Do you going to get them a set of masks? Are you going to have them logoed with your logo and so you know those are work masks? When are you know, all of the questions you need to start asking about with providing that equipment. And then the other thing is just that everyday protocol, right? What safety protocols are you going to put in place every day that your employees need to follow, and how are you going to communicate those? So those are all the considerations that employers have. Now, when we're looking at recommendations from OSHA, they basically have 3 different areas for you. So as your employees come back to work, you need to be thinking about safety on site. Here's what OSHA recommends. They recommend engineering controls. Now, when you look at that picture, it's hard to see, but if you look at the middle desk, you can see some reflection on the top of it. And that's actually just a plastic, I guess they call them sneeze guards, right? It's that plastic partition that's in between the person that's standing at the desk and the person sitting behind the desk. So are those sneeze guards or those kind of partitions, are those some of the engineering controls you want to put in place? Also be looking at your HVAC. So as your heating and air conditioning ventilation, have you increased the rate so that the air is moving through the building and you're making sure that there's enough ventilation in the building? Or is there an office you can open windows or those kinds of things? We're getting into spring and summer, so it's going to be a lot easier to do that. The administrative controls include safe work practices. So these are some of the policies and practices that you have around really canceling work travel right now. If people aren't vaccinated, you know, it's harder to get around. So maybe they're not traveling. Implementing remote work policies. You probably have been doing that over the last year. But when we get back into some people are back at work and some people are at home, you might need to revise those policies to reflect a hybrid model. And then obviously washing hands and using sanitizer and those types of things are also administrative controls. And finally, this ties into providing that equipment, but you want to make sure that they have personal protective equipment. So masks, gloves, those types of things. What other things might they need to keep them safe? So here are some tips. Prevent exposure as best you can in the workplace. You can encourage employees to stay home if they're sick. Make sure that your HVAC systems are functional, as we talked about. You can clean the workspace regularly and use the CDC recommended cleaning solutions that fight the virus the most effectively. Obviously, promote social distancing. Do those kinds of things to prevent exposure as best you can as an employer. The other thing is your employees should self-monitor. So you want them to have those self-monitoring practices, making sure that they're taking their temperature, that they're checking in with themselves about COVID symptoms. They're looking for a new onset cough or maybe new onset inability to smell or to taste things. Those types of things that we've heard about for the last year, they still need to be doing some self-monitoring to make sure that they are not showing COVID symptoms. And then you want to obviously identify and isolate sick employees. So if someone comes to work and they're sick, and you take their temperature, for example, on the way in, and you recognize that they have a fever, you want to isolate them from the rest of the employees and make sure that they can get home safely. But you don't want to introduce them to the employee population. So you're going to isolate and identify and isolate those employees. Make sure that you've got policies for the return to work after an illness or exposure. And we're actually going to go through some of the recommended protocols for COVID exposures and when they can come back to work. So we're going to talk more about that. Continue remote work when possible. You know, if somebody is ill and they can go home and work from home, let them do that if they want to do that. If they're well enough to work and they just can't come back to work because they're not cleared yet to do that, but they want to work, you know, allow them to continue their work from home if that's possible. And then make sure that you've got anti-retaliation and anti-discrimination policies in place. You don't want to be discriminating against anyone because maybe they don't get a vaccine, or they do get a vaccine, or they have COVID symptoms, or they don't have COVID symptoms, but they tested positive for the COVID virus. You want to make sure that you're not retaliating against anyone or not discriminating against them in any way. So some tips for employers. So let's talk about vaccination. You know, this is the big question. There's a lot of hype around whether or not people are going to get vaccinated, and whether or not employers can actually require vaccinations. So according to the Equal Employment Opportunity Commission, the EEOC, you can, as an employer, require vaccinations. There's a big but, however. You must address certain issues. Now, what this means is you can require the vaccinations, but if you require those vaccinations, you've got to have policies and procedures on how to handle requests for an exemption. And typically those exemptions are due to medical reasons, or they're due to religious reasons. So they're saying, I'm not going to get the vaccination due to a medical condition and I can't get it, or due to a religious reason. And so those are things that we've got to make concessions for, and we have to be able to say, yes, this is our policy based on your request for that exemption. You also want to make sure that the employees know that they have that right. So while you're making the vaccines mandatory, employees can still opt out due to medical or religious reasons. And the other thing that you need to make sure that you do is when you ask any questions about vaccinations or anything about COVID symptoms, that you're only asking about symptoms that are known to be associated with COVID. This is a fine line. You can't get into underlying conditions. You cannot ask questions about underlying conditions that might contribute to COVID, because that's protected information, and that might be discriminatory. So the only thing you can ask as an employer is about the COVID symptoms specifically. Now, the other thing to keep in mind, last year we had a federal law called the Families First Coronavirus Response Act, the FFCRA. And the FFCRA ended on December 31st. But in Colorado, we had a legislation that came into place called the Healthy Families and Workplaces Act, which started on January 1st. Now, there's a lot in that legislation, and we're not going to go into the whole thing. But one of the things is the public health emergency leave that it requires. Under that legislation, every employee, as of January 1st, has the right to miss work up to 80 hours over a 2-week period. They have up to 80 hours of leave that they can take due to the public health emergency, due to COVID. And that includes vaccinations and any recovery from the vaccination. I think we've all heard that the second vaccination is a little bit, there's a stronger reaction to the second vaccination than the first. People typically have to take 1 to 2 days off after the vaccination. That reaction hits several hours after that vaccination. So they get vaccinated, they go home, and in the middle of the night they wake up and they have chills and they have a fever and they're not feeling well, and joint pain. Some people are nauseated. So they have that. It's going to take them about 24 hours to get through that. In some cases, it's taken 2 days. In other cases, people have had some type of reaction to that second vaccination, so they need more time off. So you need to make sure that they know that they have some time if they haven't used their public health emergency leave, which is up to 80 hours. If they haven't used that time, then they do have that time to take, and that is paid time off. Now, we say up to 80 hours. If you have a part-time employee, they are also eligible for that leave. They are also eligible for time off. And the way that's calculated is you look at the 2-week time period before the incident where they needed time off, or what's scheduled the 2 weeks after that time. And that's the time that they get paid. So in other words, if you have somebody that's scheduled 20 hours a week and they work 20 hours a week 2 weeks, the 2 weeks prior to getting the vaccination, they would actually be eligible for a total of 40 hours of that public health emergency leave. So it tracks with the number of hours that they're scheduled for. Full-time employees have up to 80 hours, and then part-time employees, it has to do with that 2-week time period around the time that they're taking the time off. So I know that's a little confusing, but hopefully I made sense of that. The other leaves could also apply. So if they don't have that public health emergency leave left, if they've already used that for some reason, obviously there's leave under the Healthy Families and Workplaces Act that's up to 48 hours per year that they could be taking. And that is mandatory under the Healthy Families and Workplaces Act. It's paid sick leave. Right now, in businesses with 16 or more employees have to provide that 48 hours to their employees. After January 1st, 2022, every employer in Colorado will have to apply to provide that leave. So that could come into play. Obviously, they could take PTO. You may have to make some kind of accommodation under the Americans with Disabilities Act. So lots of leaves that could also apply. So be sure and be checking into those, especially if they don't have any time left on the public health emergency leave. So the other thing that we're seeing is that there are some conflicts that are being raised around this whole issue. There's lots of emotion around COVID and around the vaccines. And we need to keep a handle on that as business owners, as employers. We need to keep a handle on that in the workplace. Whether our employees are remote or in person, it doesn't matter. We need to make sure that we are checking in with our employees and making sure that there's not those, I guess I'll say, volatile conversations that are happening. So as an employer, as a manager, set an example. Don't engage in any kind of judgmental conversations about COVID-19 or vaccinations. Be sure and be visible to your staff, whether that's remotely or in the office. Walk around, watch for conflicts, watch out for arguments or even discussions that arise around COVID or around the vaccines, and make sure to diffuse those conflicts quickly. It's just like any other conflict in the workplace. You want to make sure that you're diffusing those conflicts quickly. Some employees may not understand that there are employment law implications for people not getting the vaccine. For example, I was talking about religious or medical reasons that they're not getting the vaccine. And we're seeing some people be very passionate about how everyone should get the vaccine. And they may not understand that as an employer, you do have employment laws that say you can't, that if people have a religious or a medical reason why they can't get the vaccine, you cannot force them to do that. And so sometimes you have to explain that to employees to make them understand that yes, they're mandatory, but people still have the option to opt out. And then if employees are fighting or arguing or there's conflicts going on, just divert the focus back to work. Get them back to work. The medical conditions, the pandemic, all of those things are not part of their workday or should not be part of their workday other than just following the policies that you've put in place. So supervisors are responsible for stopping disruptive conversations in general, and COVID and the vaccines, those topics are not any exception. If you're having trouble, if you're trying to figure out how to do it, supervisors, managers, you can reach out to the business owners. Business owners, if you are needing support on how to handle a certain issue, you can reach out to your trusted advisors, your HR consultants, attorneys, business coaches, whomever, that might have some advice on how to deal with that situation. So this next section is, what if an employee becomes sick at work? And this is, I get these questions every day almost. What happens if somebody becomes sick at work? If they have symptoms, it gets kind of mind-blowing, because if they come into work and all of a sudden, several hours after work, they're suddenly showing symptoms, what do? Well, the first thing you should do is separate them from the other workers. So get them isolated. We talked earlier about identifying and isolating employees that are sick or that have symptoms as they're coming in the door. But this would be true if they're in the workplace and all of a sudden they develop those symptoms. You want to get them isolated from other workers. You want to clean the area where the sick employee was working, maybe get other people out of that area, open the ventilation, maybe open a window, make sure that there's some ventilation in there. If there were staff that were in close contact, then you need to notify the staff that they've had a close contact with someone who is either suspected or confirmed that they have had the COVID virus. But one thing to keep in mind here is you need to keep the name confidential. You can't say, yeah, Joe's got COVID and you were around Joe, so you might want to go home and get checked. You can't use the name, and that's due to privacy laws and other regulations and other laws that we're following. You can say there was an employee who was here that is suspected of having COVID, they have left with symptoms, and if your office is small enough, they may know who exactly that is. And they may say, oh, you mean Joe. And as an employer, we can't confirm that. So you just need to say, well, I'm not going to discuss names. I'm just going to say that there was a staff person that was sick and they've left. When that person comes back to work, they don't need a doctor's note to return. That was set up many, many months ago when the doctors were just overwhelmed, and they didn't have, they just didn't have time to do those notes. So just keep that in mind. They don't have to have a doctor's note to return. Um, but that raises the question, like, what if they have COVID, or if they've been exposed to COVID, or they're immunocompromised, or they live with someone who's immunocompromised? There's so much to remember, and how do we know when they can come back to work? So what I want to do is go through a couple of those scenarios for you. Now, this information was taken from the CDC website, cdc.gov. It changes. So what I'm going to say is, this is information that I took off the website as of yesterday. So that's how recent I wanted to go and get this information. But that doesn't mean that if we looked at it this morning, something didn't change. It seems like in COVID, things change all the time. So what I'm going to do is give you this information, but then advise you to go to cdc.gov and talk about and look up if someone had symptoms or if someone had a positive test, whatever that might be, to review this information to make sure that it is still accurate. So in this situation, this scenario, you've got someone who either thinks or knows they have had COVID-19 and they had symptoms. So what you want to do is you want to make sure that before they come back to work, that they meet these criteria. It's been 10 days since the first symptoms appeared, and they've had 24 hours with no fever, with no use of fever-reducing medications like Tylenol or something like that. So 24 hours no fever, and they're not taking medications to knock that fever out. And the other symptoms of COVID are improving. Now, in that situation, they should be able to be around other people. This is not including severe cases or immunocompromised people. So if people with severe cases or they're immunocompromised, we're going to talk about in a minute. But this is just, I think I had COVID, or I know I had COVID and I had COVID symptoms. The next scenario is you tested positive for COVID, but you had no symptoms. So you have to meet these criteria: 10 days after the positive viral test, if no symptoms. If a healthcare provider wants you to take another test, then return when they say they can return to work. So if the employee has to take another test to see if they're negative, and that's what the healthcare provider is asking for, then you want to make sure that they're following their healthcare provider's recommendations, period, regardless of anything else. Someone who is severely ill with COVID, or that person is immunosuppressed, then it's usually 10 to 20 days after the symptoms first appear. That may require testing. So in these situations, the employee should talk to their healthcare provider. So if they call you and say, when can I come back to work? If they had severe illness or they're immunosuppressed, I would tell them to just go to their healthcare provider to get information. And this is one of the most common ones. I've been around someone with COVID. So in that situation, wow, I found out that my neighbor had COVID and I was over there last night talking to them and I just found out. In that situation, it's 14 days since their last exposure, unless, and this is where the vaccinations come into play, the employee is vaccinated or they've already had COVID-19 in the previous 3 months and they recovered and they don't have symptoms. So one of the reasons I wanted to bring this up to you today was because this is one of the most confusing parts of people returning to work. What do we do if somebody has symptoms? What do we do if somebody's sick? So hopefully this information has been helpful. And again, please refer to cdc.gov to get the most up-to-date information. So with returning to work and some of the logistical things we've talked about, as well as some of the COVID vaccine symptoms that we've talked about, make sure that you're understanding that your employees may or may not want to return to work. You know, we're finding that employees really want to have that hybrid model. Is that something that you can offer them? Is that something that works for your particular business? Employees may or may not have a leave qualifying reason to stay home. So maybe they just are afraid to come to work. And in that situation, make sure that you're talking to them about what you're doing to make the workplace safe. Or they may need to stay home because they have symptoms, and that would be a leave qualifying reason. Or they may need to stay home to take care of someone who has symptoms, and that may be a leave qualifying reason. So they may or may not have leave qualifying reasons to stay home. Just because they want to stay home because they're scared of getting COVID, that is not necessarily a leave qualifying reason, and might be something that you talk to them about. Well, okay, you can work from home, I'm okay with that. Or no, if you're going to stay home, you need to take PTO. So you'll have to talk to them about those reasons. Communication is the key with employees coming back to work. You want to communicate to them all of your plans. You want to talk to them about their reentry plan, and we're going to go over that here in a minute. You want to have conversations with them as much as you can about everything you're doing as a business, and then you want them to communicate with you about any symptoms that they're experiencing or any exposure they might have or any concerns they have. So communication is key. Make sure that you're following COVID protocols and educating your employees, and then know what to do if someone gets exposed or sick. So there you have it. Now we're gonna move out of this and move into resetting employee expectations. And what do I mean by that? We've
Courtney,
been off for a while. Oops,
can,
yeah,
can I
yeah,
interrupt for a second with a few?
absolutely.
Okay. What are your thoughts about soliciting employee input and suggestions on those engineering and administrative controls? I think the concern is, does that create an obligation for the employer to act on all the recommendations?
Sure, great question. I think that what an employer should do is actually say, hey, I want your suggestions. You know, if you see something that's going to um, enable us to be safer, I want to know about that. And it shouldn't just be limited to the engineering, the engineering controls for COVID. It should be engineering controls for anything, any safety violation, right? Or any safety concern that people have. And so you should ask them for that. Make sure that you're saying to them, we may not be able to implement every idea, right? One of the ideas might be, well, I know we have an open workspace, but we should all have offices. So let's redesign our office and put individual offices in for everybody. That would keep us safe. Well, maybe, but that's cost prohibitive. So you're going to have a conversation with your employees about, I want your ideas, but realize I may not be able to implement every single idea. And that may be due to cost reasons. It may be due to just other information that you as a business owner have about the organization. It's a great time to have my what I call 20 moving parts rule. And that is that employers, business owners know the 20 moving parts of the business, and employees may only know 5 or 6. And so the employees say, ooh, we should do this based on their knowledge of those 5 or 6 moving parts. And the business owner knows all 20 and realizes that isn't going to work because an item that the employees don't even know about would not allow that to work. And so having that conversation about, I really appreciate your idea. Unfortunately, we can't do this right now. And if you can tell them why, tell them why. And if not, you need to just say, unfortunately, our business just at this point is not going to allow that. So
Great,
have that conversation with them, ask them for their input, but then also reassure them that you welcome the ideas, you just may not be able to implement every one of the ideas.
great. Uh, Next question, can I put proof of vaccination, like a photo, in employees' files?
That's a great question. That's a great question. Um, can you put it in the files? Yes, but if you do that, you need to put it in the medical file. So you need to keep it separate from all of your employee files. And what I'm talking about with this, and it gets into employee files a little bit, you want to pull information out of that employee file that has to do with anything that is a health condition or a medical question. And that should be in a separate medical file for that employee. What I used to do was get red files for my medical files, and then anything from workers' comp to a doctor's note to a request for leave due to a pregnancy or whatever, I would put in that medical file. And so you can put that picture of the COVID vaccine card in that medical file and keep it separate from the employee file.
Fantastic. Thank you.
Yeah, absolutely. Thanks for fielding those questions for me, John. I really appreciate it.
You betcha. And to our audience, keep them coming.
Okay, great. So resetting employee expectations, as I was saying, we've been off for a while, and it's not that we haven't been working, because we have, but we haven't necessarily been working in the workplace in our offices or at the on-site location. And so when employees come back from that, or if you've had employees that have come back, you might want to do reentry meetings or a reset meeting and a staff meeting with everybody, or meet individually with the employees just to talk about their individual concerns would be a good idea. So whether or not you're just coming back now or you've been back for a while, if you haven't done reentry meetings, I really highly suggest them. And what do I mean by that? Well, with that reentry meeting, you can talk about safety protocols. If employees are concerned about coming back to work and they're not sure that they're going to be safe, you can go through each of the safety protocols you have, outline them, walk through them with that employee, talk to them about best practices, show them policies, all of those things, so that they know what's expected of them from a safety protocol standpoint that may be in addition to any other safety protocols you have, that you've had before. So you want to make sure that you review maybe some of those other safety protocols as well if they haven't been there for a while. So go over all those safety protocols. Make sure that they understand that you want them to stay home if they are sick, and talk to them about that. Like, check in with yourself in the morning, and if you're sick, stay home, call in. If you want to work from home, that's great. You can work from home. We have that option now. And this is what that looks like. Talk to them about a hybrid workplace. If you're comfortable with having some people stay home and other people in the office, and then, maybe on the opposite days of the week, they can switch. And so the people who are home come into the office, et cetera, then that's fine. Talk to them about a hybrid workplace. Maybe get what days would work best for you to be in the office, what days would work best for you to be at home, and see if you can, accommodate that schedule. Again, telling them you may not be able to accommodate every desire they have or every day that they want to work in the office versus home, but just find out what would work best for them, and get that information from them. Make sure that you talk to them about communication. And this is true of, hey, we're going to be communicating with each other. We're going to be in person. What does that look like? What kind of meetings are we going to hold? How long are we going to hold them? How does that fit into social distancing? Talk about that kind of communication, but also talk about communication where, maybe John and I are coworkers and we're working on a project, and John's in the office and I'm at home. And somebody comes into John's office and they make a decision on the project that we're working on, and John moves forward with it. He's got to remember to communicate with me at home because I'm not in the office. And so just having a visual person there sometimes reminds us, oh, I've got to tell, so-and-so something. So in that case, you want to talk to the employees to make sure that they are keeping the remote workers in the loop of any communication. And as a business owner or manager, you need to make sure that you're doing that as well. So there are going to be decisions made that maybe the remote people don't know about right away. Make sure that you're sending them an updated email at the end of the day. These are things that happened today, or at our staff meeting, after the meeting ended and everybody broke up, another topic came up and this was the topic. And so we want you to know about it, that kind of thing, so that you're making sure that they're in the loop and they have that communication. And then client protocols. There are probably going to be some different client protocols. I know I've gone to get my hair cut and they taken my temperature and asked me about symptoms and made me sign a form. Okay, great. You know, are you doing that with your clients? And what are you doing with that information after after you take that information? That is also something to keep in mind with employees. If they're coming to the door and you're taking their temperature and asking them about symptoms and then making some kind of note of that, again, that medical information needs to be in a separate file. It needs to be in their medical file. Or if you're just kind of having one sheet to log everybody for that particular day, then that needs to be in a separate COVID file that you keep all of those sheets in there. It needs to be separate and kept confidential, and access to it needs to be limited. So it's important to take the time to reset those expectations about hybrid work arrangements, communication across the organization, any kind of work expectations that may have changed, maybe some reminders of these have always been our work expectations. These have always been our values, and this has always been our mission. And we're continuing to follow that path. We're just doing it differently now. And this is how it's different. And this is what's still expected. And these are some changes. Make sure that you're communicating all of that information to your employees. And also, it's important to let them know that things may change. So every day I get an alert that Denver is having a COVID update, or Jefferson County is having a COVID update, or Broomfield, you know, whatever that is. So make sure that you let them know that you're keeping an eye on that and that you're going to update things as needed based on what the state or the localities are doing. All right, I want to move into mental health just quickly, and then we're going to open it up for just questions from anybody. But the mental health is so important right now. We are seeing increased suicides, increased stress at work, increased work violence. Um, it's almost out of control. And so as a supervisor, as a manager, as a coworker, as a business owner, we need to make sure that we're keeping an eye on the team and we're identifying those people that are stressed, and we're identifying the individuals that need some help. And then we're helping them to the best of our ability. And how can we do that? I think it's important to make sure that you know that it's more than just COVID. People have been in homes that with their families for a long period of time, and as they're coming out of those homes, they're maybe seeing some relief, but maybe having some separation anxiety. It could be that they're stressed to come back to work. It could be that, as silly as you know, people joke about it, that their wardrobe is becoming a stressor for them in the morning and what they're going to wear. It could be that the expectations that are being set are scary to them, and they could just be overall scared about being in public or being exposed at a higher exposure rate than they were at home. All of those things can be happening. So here are a couple of lines. The Colorado Crisis Services phone number is there, and the suicide hotline is there. You'll notice that the last four digits on both both phone numbers are the same, and that is correct. I double checked it. It's actually the word talk at the end, TALK, on both of those numbers. But please write these numbers down. If you don't have an employee assistance program or mental health services in your benefits package, the Colorado Crisis Services or the suicide hotline should be a number that you have readily available, and you can give those to your employees. You can just let them know what it is. You can post it in a break area so that people can quietly take that information. You can, if you're talking to somebody and you're concerned about their mental health, you can give them these numbers just privately on a little sticky note or a piece of paper, or text them to them so that they have the numbers and have those readily available. We are not mental health providers. I mean, I shouldn't say we all aren't, but many business owners aren't mental health providers. So we need those resources that we can reach to if our employees are hitting a stress level or hitting an anxiety level that they need some professional help. So please feel free to jot those numbers down and give those out liberally. Give them out to as many people as you can, even friends and neighbors. You know, make sure that people around your community have those numbers as well to help them. So that covers what I wanted to cover today. It looks like we've got a few minutes left, and I just want to open it up to any questions. My information is right there, my phone number. I noticed I didn't put my email on there. I'm sorry. My email is cberg, so it's CBERG at courtsidehr.com. Or you can just always call my office number. It's showing there, and I will get back to you as soon as I can. So, John, do we have any questions or any comments that we should cover?
Well, I'm looking, and I don't see any in the chat or the question box, but we can stay on for a few minutes and see if anyone thinks of one. I was reading a little bit before this, and I was looking at a few statements about sort of returning to in-person work, and I wanted to run them by you and see if they resonated or if you thought they were they were bogus. So one I read said about a quarter of workers say they are less satisfied with their job now than they were before the coronavirus
Hmm.
outbreak.
That's not surprising to me, John. I think what happened was we were all working in one environment. We all had a culture that we all worked in within our work environments. We had that social interaction. We had team spirit. We had the culture of the organization. And when we went remotely, we lost some of that. It is difficult to maintain an organizational culture in a remote environment. It is not impossible. In fact, I worked with a client who had 40 employees across North America. They had employees in Canada and in the United States. They were 100% remote, and they had a fantastic culture. But they worked at it every single day. And so I think what happened was we took people that weren't used to working remotely and we put them in remote situations, and it's difficult. It was challenging. So the 25% that are feeling like, well, I don't feel as engaged with my employer, that could be why. And that could be part of the reentry conversation. Is just
Mm.
let's revisit culture and let's talk about the impact that working remotely has had on our culture and how we get it back. And then work with the employees to get that back.
Yeah, that seems really important. It is a fresh start.
Yeah, absolutely. Which is good, right?
It's a huge opportunity.
Yeah.
I saw another one that was interesting. I'm sure you're aware at North Metro SBDC, we've been focusing a lot of programming on childcare providers. And I was reading a little bit about childcare statistics and returning to the workplace. And it seemed like statistics were saying that among remote workers, women were more likely than men to say that they want to continue remote work. And yet, this statement from this survey says 4 in 10 working mothers say it's harder now to balance work and family responsibilities with working from home.
Yeah. Yeah, that's really interesting information. I hadn't seen that. I feel as though um, balancing work and home when you work from home is an art, I think. I I've worked from home for the last 13 years, and it took me a while to figure out that I had to designate a place in my house that is my work spot,
Mm-hmm.
and that when I went into that spot, it was work. And when I left that room, when I leave my office, then I'm at home. And when I have to go to the kitchen during the day, while I'm working, I think about, okay, if I were in the workplace and I need to go to the kitchen to get something to drink, that doesn't mean that I stop and load the dishwasher or that I, do something. It's my work day, and so I kind of have to put that mindset on and then come back and sit down and go to work. So it's a mindset, and it is more difficult, and it took time. It took time for me to figure out how to do that, and I tried a couple different places in my house, and I did a couple of different things until I came up with my current setup. But I feel as though that is an art, and it's something that everybody has to go through to figure out, how do I make that distinction between work and home? Um, and sometimes it's just, there's my office, and when I leave my office on Friday night, I shut the door and I don't go in my office until Monday morning. You know, if I want to work over the weekend, that's fine. I take my computer out of my office, take my laptop and go somewhere, and I can work from home like I normally would if I had an office outside of the home. But I stay away from my office if I'm not working that weekend. So I think it's a mindset and just setting up habits.
Agreed. Agreed. It's a skill, and like anything, we all get better the more we do it, hopefully.
Yeah, absolutely, absolutely.
Well, thank you so much for this presentation, and I'm not seeing any more questions from our audience. We're coming up on an hour, so I think we should wrap it up. I'd just like to remind everyone, that you can always book an appointment with Courtney or any of our consultants for free by visiting us at northmetrosbdc.com. And all of our consultants are just, they're really friendly, nice people that want to help small business. And so visit our website, click the link, book an appointment, or give us a call at the number on there. And we'd be happy to help you, support and grow your small business. And Courtney, thank you so much. People should visit your website as well, courtsidehr.com. And once again, I just want to say thank you so much for your time and for putting this together. It's been a really valuable resource today.
Well, thank you, John. Thanks for the invitation. It's always a pleasure to present to the SBDC.
Well, thank you very much, and we'll see you on the next one. Goodbye, everybody.